When patients come and see me for a brain tumor, and they can be cancers, malignancies, or they can be benign. Either way, honestly, it's scary. And what we're here to do is to tell you what it's about and what the next steps are to get the optimal outcome for you. So we act as guides, and we provide you information to make things less scary. The first step is to really figure out what it is. And so we focus on that. Then we focus on what do we do for it, what are the treatments? And that could involve removing it by surgery, that could involve medicine, and could also involve radiation. Finally, it might also involve clinical trials, which are really exciting, and that's really what we use to push the new standard of care. My laboratory focuses on brain tumor biology, and we focus on two specific things. One is super fundamental and basic biology, and the other side is very much clinical translational. The first is that we study this very interesting population of cancer cells. Every tumor has these cells. They're called cancer stem cells. And they're particularly mean because they're the ones that can resist therapy, and they're the ones that grow and cause tumors to come back. And so we're trying to understand the vulnerabilities of those cells. The other part of my lab is studying something that we use in the operating room right now. It's called laser interstitial thermal therapy. It's a mouthful, but basically it's laser therapy for brain tumors. And what does that mean? So that means through an incision this small, we use robots to place a laser probe inside a tumor, and then we kill it from the inside out. And often these patients can leave the same day, which is kind of astounding. So we study how this laser works beyond just killing brain tumors. It turns out the laser also does other almost magical things. One, it opens up the blood-brain barrier in that area that you laser. What does that mean? That means drugs that normally couldn't get into the brain can now flow into the brain and kill those extra cancer cells. The other interesting thing that the laser does is it actually stimulates the immune system, and that's something we're studying, and perhaps we can combine with immunotherapies for new clinical trials. Siteman is really special for a number of reasons, and I would say it's because of three things: talent, science, and technology. And what do I mean by that? So talent, I mean the people. And so every physician at Siteman Cancer Center is also a Washington University physician. Washington University School of Medicine is a premier medical school with experts in every discipline. So you have great people, great talented people. For instance, we have immense experience with brain tumors. Our Department of Neurological Surgery probably does over 1,200 brain tumor procedures per year. That's an amazing number. So we have a lot of experience. The second thing is science. And so we base everything on the best available evidence. And then if that's not good enough, we have clinical trials for you that we can use to maximize your outcome. And then third, some places have certain tools, for instance, radiation therapy, conventional radiation therapy. Other places have gamma knife radiosurgery. Some places have intraoperative MRI, and then other places, let's say, have proton beam therapy. The thing is, we have all of them. And so we don't have to be biased about what we use. We can just pick the best technology for your brain tumor. I love treating patients because, making them better, it feels great, but sometimes you can't do that. And so sometimes you're really just there to hold their hand and walk the path with them, walk the journey with them. And that's also really gratifying. When I see a brain tumor patient in front of me, what I'm thinking is, what would I recommend to my family members? I do tailor my ultimate recommendation, but I do treat everyone as if they were my family member.